It's a beehive of activity at Ngurunit Health Center in a remote village in the dry Marsabit County in northern Kenya. Residents have gathered here, some traveling tens of kilometers to seek medical services. On this day, the U.S. medical charity Mission to Heal is providing more advanced medical equipment and training local medical workers to use it.
We take the experts that live here and we bring them in there and show them how it is that we can do things and get the principles without the plumbing. Taking care of the people in the context of their culture and their family setting is something that's going to happen here.
Mission to Heal founder Dr. Glenn Gilhord says their goal is to empower local caregivers with knowledge and skills to improve medical services in remote locations like this.
How do you tie the last knot?
Meshak Lekeda is a local nurse at the Ngurunit Health Center.
They've even taught me how to manage some new conditions here and there that I never knew before. And they've even equipped me with the equipment.
A 2019 report by the U.S. National Institute of Health found that a key problem facing the healthcare in Africa is weak training and education of workers. Kristen Alcon, a volunteer, says Mission to Heal can help.
They have the knowledge, but their resources are limited. And so I think that we can help them try to best manage things and come up with diagnoses and come up with the best possible diagnosis and treatment with their limited resources.
Senaheya Kalaili traveled over 30 kilometers to seek treatment.
I came here in a lot of pain, especially my abdomen. The doctors gave me 2 injections and medicine, and now I feel better. The pain has gone down.
Volunteer medical students say they are learning too.
Obviously the culture is very different and the resources are very different, so there's been a steep learning curve in terms of figuring out what we can do and really what we should do.
For me a big thing was like using gloves for the second time. Back home we use the gloves and we toss them. It's not like normal to use it the second time, and they do with everything.
The UN Development Programme says some 408 million people in sub-Saharan Africa still don't have healthcare. Mission to Heal says it has trained 3,200 healthcare workers on the continent. Juma Majanga, VOA News, Ngurunit Village, Kenya.